Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Welcome to Let's Talk eHealth, where we showcase the projects and people of eHealth New South Wales. I'm Danielle Johnson, Delivery Manager for Cloud and Enterprise Infrastructure Services, and today we're talking about MedSync. I'm joined by Miranda Pye, Nurse Practitioner in the Burns Unit at Concord Hospital at Sydney Local Health District, and Simon Plummer, MedSync Product Owner from eHealth New South Wales. MedSync is a secure clinical communication platform built in Microsoft Teams made of 3 elements. MedSync Upload, which allows clinicians to upload images and videos to statewide systems. MedSync Connect, which enables them to collaborate with external providers, and role-based messaging, which allows them to communicate by role. It is available on personal phones or New South Wales Health devices and is already being used by 11,000 clinicians across New South Wales. Today, we'll focus on Connect and Upload, and next month, we'll do a deep dive into role-based messaging. Welcome, Simon and Miranda. So lovely to be with you today.
Thanks, guys.
Yeah, lovely to be here. Simon, I would like to ask firstly, what is MedSync and why was it developed?
So there was a large demand across the health system for a mobile clinical communications platform. So then consideration was given to partner with Microsoft to develop some in-house capabilities in our Microsoft 365 licensing, the existing Microsoft Teams platform, and other important statewide tech infrastructure such as our networks, our Wi-Fi, electronic patient record, enterprise image repository, and our HealthyNet portal. There was a steering committee formed after that with our Ministry of Health partners, the LHDs, the Agency for Clinical Information, and finally the Clinical Excellence Commissions. eHealth then spun up a project team to work with the Clinical Reference Group. We worked with over 100 varying clinicians, listening to input from across the state to gather their detailed requirements and assess the priorities needed for a mobile clinical communications platform.
Excellent. Thank you so much for that background. Can you tell us, why did you choose to build it within Microsoft Teams?
We use Teams as it has the ability to host the applications on its own platform, and it keeps all the MedSync data securely inside our New South Wales Health infrastructure. When users sign into Teams, they're doing so securely using our 2-factor authentication. And then once they're signed in there, it allows access to MedSync, and it's all nice and safe and secure.
Simon, that sounds like a fantastic undertaking, very broad consultation, and that it's already having positive impacts on the system. From your perspective as the product owner, what has been the impact of MedSync on patient care?
Yeah, so previously, if any clinical photography was being taken, the process is to have it uploaded was fairly cumbersome and only available in the local LHD systems that it was taken. So with MedSync, the process has been very quick, which encourages its use. Then it's beneficial to patient care by means of sharing and referring to the images taken, so these can be collected and documented over time.
Excellent. Now I might turn to you, Miranda. Can you tell us a bit more about your role and what you do on a daily basis?
Sure. So I'm really proud to be a nurse at Concord Repatriation General Hospital in our Burns unit, and I've worked here for over 22 years. My current role as nurse practitioner is overseeing our rural telehealth service, which provides patients from over 11 different health districts in New South Wales real-time video specialist burn support to help eliminate the need to travel to Sydney, but to ensure that they received expert care.
Excellent. And as a bit of a champion for MedSync, can you talk us through how MedSync fits into a typical day for you and how collaboration has changed since implementing the solution?
So MedSync has really revolutionised our service to not only store patient-sensitive wound images, but also the ability to share images between local health districts. MedSync allows us to do this in a safe environment through the electronic image repository, which really ensures that we are able to assess wounds in real time and collaborate as clinicians between area health services. And I think the beauty of MedSync for me is it also includes people that work outside of New South Wales Health. For example, we're able to use the app MedSync Connect to do real-time video calls with general practitioners and nurses in nursing homes as well.
A whole raft of benefits, Miranda. What has been the most impactful benefit from your perspective using MedSync?
So on a professional level, it actually saves me over 5 hours of clinical time a week in uploading images, because our previous system required individual uploading into a share drive. And the reason for that is our burns images are often very, large files, and we're looking at images upward of 10 per patient per dressing change, whereas other like apps only allow us to upload 4 or less images at a time. And so this saves us time. It also has the wonderful feature of being able to label the location of the wound, which can sometimes be hard to assess without that exact understanding and label. And it also has the beauty of inbuilt consent. So there are some selection tabs that the clinician can use to document the level of consent that's been obtained for that practice.
That's fantastic to hear, Miranda. So it's also helping patients and empowering them as citizens to be empowered of their healthcare, but also the clinician and saving time, which is fantastic.
Danny, I'd like to add too that it's actually really wonderful for other clinicians. So for example, when we're transferring patients between area healths, we're able to look at previous images and review those so we can monitor wound progress in a much more reliable manner. But it also saves those clinicians time. And an example of that is where we're doing video calls through MedSync Connect to down-end sites, providing this burns care and using from mobile to mobile device, a text message is sent to initiate a video call, and the patient can then answer that call. And it's a wonderful distraction tool during that procedure so that the nurse or clinician can focus on the clinical requirements, and myself as the up-end clinician can really assess, talk to that patient and use it as a distraction tool, but also as a way to assist that clinician down end with their time management. We can then take those photos, take a screenshot and upload them via MedSync in real time into their file. So it helps everybody get a clear picture of what's going on and record the consultation.
Really positive feedback there, Miranda. Simon, how have you been using clinician feedback and how has this shaped the evolution of MedSync over time?
Yeah, good question. So currently we have over 11,000 active users. And we're getting close to that magic 1 million upload mark, which is amazing. And we set up a community of practice initially where we hold meetings with our MedSync users, which contains clinicians, admin people and anyone else from the MedSync community at large, which is it's a great forum where we share good news stories and talk about processes. And then we ask people to provide feedback and we look for ways of improving and to continue to improve the app.
Excellent.
We also have surveys built into the app, which run from time to time. And we've also done some email survey campaigns in the past to try and collect some feedback to then work on new features, enhancements.
I think that's a fantastic approach to evolving MedSync over time, to really take on board that feedback and collaborate with your users. So looking ahead, Simon, how do you see MedSync evolving so it keeps meeting those future healthcare communication needs?
I guess increasing the adoption and then regularly reviewing our technology to see where improvements can be made. For instance, perhaps having the ability to scan a barcode using the patient's ID bracelet with the clinician's phone. That would help in a way to save the clinicians having to manually enter patients' details.
Miranda, what role do you see MedSync playing in the future of patient-centred care as a clinician?
So I think in an era where virtual care is not only required but expected by our patients, it's important that we keep evolving these apps, but also rolling them out through other sites that perhaps are not currently using them, and ensuring that clinicians are aware of this valuable tool so that they can utilise it. I would, in a dream world, love to see real-time video calls with patients directly, particularly patients who maybe live 4-7 hours away from specialist or their local healthcare centres, so that we could provide that wound care directly in their homes as we do now. I'd like to see, a bit more of that being mainstream, not just in burn spaces, but others, ear, nose and throat, dermatology. There are so many other areas that would benefit from utilising this wonderful tool. So I guess just having enthusiasm and driving that change, I think if people just gave it a go, they would see how useful it really is.
And as you know, technology can be daunting and does evolve quickly, but it is very vital to healthcare. What would you say, Miranda, to a colleague who says, I don't have time to learn to use another system? As an early adopter, what would be your advice?
It's extremely easy to use. And if you just put in those few, 15, 20 minutes to learn it, because that's all it takes, it's so user-friendly, you will see dividends in the time that you can recover and not waste uploading, saving images, looking for them.
Excellent advice, Miranda, and worth giving it a go, certainly. So Simon and Miranda, a question before we depart for both of you. Simon, what sets MedSync apart from other communication tools in healthcare today?
So as Miranda was saying just then, it's easy to use. And the way we designed it was so that it was device agnostic, which means that it's available on any platform, iOS, which is Apple, Android, Windows. It can be used on a desktop, it can be used on a laptop. So it's really accessible.
Excellent. And Miranda?
So I think MedSync is unique because it allows us to upload up to 10 images at a time. It saves them securely. It allows us to look at them between LHDs, which no other system currently does. And the uptake I've seen, particularly with the rural clinicians I work with, has been amazing. So I know they like it. I know they're using it. And it's really helped our collaboration improve as a whole so that the overall patient experience is optimised.
Thank you, Simon and Miranda, for joining me today to discuss MedSync. It's been a pleasure having you both.
Thank you. Thanks for your time.
Yeah, thanks for having us.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.